Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Oldest is autistic and has been diagnosed with separation anxiety and demand avoidance. We homeschool because the separation anxiety is just too big for him. And every day was a multi-hour struggle to get him to leave. And then he was miserable the whole time. He's only really okay being alone if he's reading. He loves his little brother, but since his little brother was around 2, the 10-year-old has this overwhelming need to menace, harshly criticize, attack, or threaten him. He's never deliberately hurt him physically, and he's actually very protective of him. A lot of his harshest behavior is when he's worried his brother is doing something unsafe. He feels awful about how he treats his little brother, but he doesn't believe that it's possible to learn to change, and we're at a loss for supporting him. It seems to us that he's in a constant state of fight or flight, sometimes even if we're just snuggling on the couch, because snuggling with someone while reading a book or playing a board game is like his idea of heaven. My wife has a background in special ed. We believe very strongly in respecting children as people, in playfulness, setting limits with warmth and compassion, etc. Some of the behavioral approaches that have been recommended to us seem antithetical to those values or seem impossible to implement outside of a very controlled therapeutic environment, which a home is not. And they have said help in big capital letters. It's Dad Day.
Yeah, it is true. And also very eloquent dad who has really analyzed this and thought this through. So this is very important. There's a lot of different parts of this question that I kind of want to address. Just talking first about what's going on with your child. Social anxiety, absolutely. I mean, and just the fact that you start with he has social anxiety, demands
separation anxiety.
Separation anxiety it's anxiety, right? And anxiety is always best treated, and there's thousands of articles on this. Anxiety is always best treated when there are 2 interventions occurring at the same time. One is behavioral or cognitive behavioral, depending on the level of the child. And the second is medical. And so we have a lot of different medications that help anxiety. I don't know if you are perhaps not really interested in trying medications, but I'm going to tell you about them. The medications that are used for anxiety are the same medication that is used for depression. Anxiety and depression are pretty much the same disorder. One is turned internal, one is about external. They're pretty much the same thing. And the medication is therefore the same. The medication is serotonin reuptake inhibitors or medications that control our neurotransmitters. So they could be norepinephrine reuptake inhibitors or serotonin reuptake inhibitors, but nevertheless, they are very effective, and they do not change your overall behavior in a way that is noticeable. In other words, they don't change your personality. Let's put it that way. They don't change your personality. They don't interfere with your thinking. They just simply allow your own serotonin to remain in your body for a little bit longer so that you uptake, the next nerve cell receives it. And so just over time, over a period of 3-4 weeks, these medications result in us having slightly higher levels of our own neurotransmitters, serotonin being the key one, which makes us calm down a little bit. They make us less agitated. They make us lose our temper less. They make us just a little bit more positive and feel safe. They make us feel safe. They make us feel in charge of our environment. So I do recommend that for you. I also suggest that you maybe work, depending again on the level of functioning of your child, work with a behaviorist or a cognitive behaviorist to focus on just activities and exercises that your child can do that helps them feel safe. Because clearly there's, everything you said. It's separation anxiety, which is I don't feel safe unless one of my parents are here. Cuddling and being cozy is very much like having a safety blanket. This is my safe place. There's a lot of stuff you can do that will help your child gradually let go of being that attached to you and actually still feel safe. And again, even his biggest fear and control over his sibling is about safety. He's worried that his sibling is doing something unsafe. So there's something going on with your child about just safety and not feeling safe and secure in their own world. And that's something that a good therapist can help you with, because there's a lot of activities that you can do where your child begins to feel safe. So that's super important. That's what I recommend you do. And there are different types of behaviorists. I can understand from where you're coming that ABA contingencies might not work for you. You might find them to be tough. And you are right. A lot of times ABA is much more effective in an experimental setting, and it's harder to implement in the home, but it is possible. It's just harder to do. All that aside, the other portion of what I really want to quickly say is, please pay attention to the sibling. So many times, the entire family unit is focused on the child with special needs, and the sibling just doesn't get the attention, and they don't get what they deserve. So I know it's hard. I know you're limited. I completely understand that most parents are doing as much as they possibly can. I get that. But make sure that your sibling is not victimized by everything else that's going on, because your sibling has their own needs. The sibling has to also have their own. Does the sibling ever get time with you and your spouse alone? Does your sibling ever get their own special attention? Can you please work with a therapist to make sure that your sibling is adhering to rules you set and not necessarily adhering to rules that are made by your special needs child? Because that's just too much to want to make sure you're happy and want to make sure their sibling, the special needs sibling doesn't get mad at them. That's too much. So you have to turn things around and make it okay for the sibling. That is vital, I think.
Yeah. But I want to acknowledge though something you said though about, I think a lot of times parents think, well, my child is experiencing anxiety, so there's no toolbox, there's nothing to be done. And nothing could be further from the truth. That one of the things that a lot of our kids have is that they are, they like rituals and they like rules, and we can set different rules for them. We can change it around. We can help them to deal with their feelings. We can give them coping techniques. But you have to be willing to do all of those things, and it takes time and patience. Right. There were so many more questions I wanted to get to, both live and from the weekend. I want to remind you that Dr. Granpeesheh can answer questions on TikTok now.
So just quickly, Shannon, because I read the last question about sleep and from Renee and Elvira. I just want to say, you guys, I just did, I think, 7 segments on TikTok about sleep. And they're all going up this week. And one of the questions is exactly this, Renee, which is, you're sleeping with your child, and how do you exit yourself from their room? So check out Ask Dr. Doreen on TikTok. It'll come up sometime this week.
Okay. So, and we'll move some of these questions that we've gotten where appropriate over to ask Dr. Doreen, and of course she'll be back next week as well. I want to thank Dr. Granpeesheh for being here and for all of her wisdom. I want to thank all of you for being here. Please don't miss tomorrow's show. For the first time ever, we're having Rachel Bird on. She is the mom of Kobe Bird, the actor. We've seen him on The Good Doctor and of course on Netflix's Lock and Key, but we've never had mom on before. And she makes the most incredible gluten-free, dairy-free things you would ever. She has an Instagram that you should check out that it's called Small Kitchen Big Flavor. Plus she can craft anyone under the table. I swear she's like Martha Stewart in a different pair of pants. And the gluten-free, dairy-free version, but she's also hilarious and one of my best friends. So she's going to be here tomorrow to talk about all of those things and how you raise a scholar and a gentleman to be an actor on on many shows. So all of that tomorrow. And then on Thursday, Nancy Alspaugh Jackson joins us. We've got an amazing mom, Becky Estep, for our autism family portraits and other wonderful guests. So tune in for that. We'll be back tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye-bye.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.